As you know, because it was posted on the Batavian and confirmed by the county director of health, the interim director of health, Randy Garney, that the hospital did have a confirmed case of a healthcare worker with the H1N1 virus. And what's most important, why we wanted all of you to come here today, is so that we can relay appropriate information to the community, so that we don't, because there's so many questions about H1N1 and they hear so many things in the press regarding the most negative aspects of it, that this way we could convey information is important in addressing the illness and how to keep them from coming down with H1N1 or influenza, which is something we do every year during flu season. We send out a press release reminding people it's flu season is here again. We had confirmed cases of influenza in Genesee County when it's typical seasonal flu. It's just that right now, because it's the end of June, people are, and it's H1N1, that people are paying more closer attention. So on Tuesday, we did send a memo to our staff because they had heard a rumor, and we think it's best to be upfront and transparent, and that's very important, to be transparent whenever possible, to let them know what had occurred and what steps they should take, and also letting them know that now that it is here in Genesee County, what the symptoms are, and that we do not want them to come to work if they exhibit any of those symptoms, that they should call in and stay at home so we can prevent the spread of it.
Okay. Well, basically, when I received the call that we did have a patient that had, an employee, I'm sorry, that had symptoms, we worked together as a team with people in the ER. They used the computer system. We got together lists of all the patients that that particular employee had seen. And from there, we made a list of who their doctor was. And what we did is we sent a message to a note to every doctor and saying that your patient was exposed to a person who was a probable case of H1N1. Along with that, what we did is we sent the guidelines for who should be treated with prophylaxis if they were at high risk, and what they should be treated with. And that was sent out to their doctors the very next day. Along with that, the other thing we did was regarding employees. We made a list of all the employees that may have had contact with that particular person, and we provided them with the guidelines for who the state recommended taking prophylaxis, and we gave them that information, and they were sent over to corporate health, and they have the option of either accepting the prophylaxis or not. We also introduced a little screening tool for them where we encouraged everyone with potential exposure to assess their temperature twice a day and to look for the symptoms of cough or sore throat if that was new to them. And if that did occur, they were not to report to work. Basically, the seasonal influenza is gone, the one that we see every year. And the New York State Department of Health, who is doing any confirmatory testing on positive influenza tests or suspect influenza tests, I believe the last report I read said that 90% of them were H1N1. So they're pretty much saying that if you do have those symptoms now, it's H1N1. Another thing too is the very first one that called in with the same similar symptoms had no contact with the first case that we identified. And what seemed to happen almost simultaneously is our ER suddenly was having an increased number of patients coming in that had the same symptoms. And the doctor's offices, this Monday, we started the investigation on Sunday, and on Monday the doctor's offices were calling quite rapidly, saying, what do I do with this, what do I do with this? So it was happening within the whole community, I think, simultaneously. I'm hearing different about this is that they're saying you should consider yourself communicable for 7 days, and I believe with regular flu they're saying 5 days. Aside from that, I think everything is pretty much the same. Keep in mind they do estimate there are 36,000 deaths per year from the regular flu. But we've just sort of lived with that and not thought about how serious that is.
We always, because we work in healthcare, always recommend that people respond to any influenza or any communicable illness aggressively, and not that they should do more now than in the past. They should have been doing as much in the past as well.
First of all, the New York State Department of Health is telling anyone that has them to call their primary care physician. Don't show up at the emergency department and don't show up at the doctor's office, because what you're doing then is you're exposing other people. the guidelines are telling the doctors that if you can triage that patient over the telephone, if you know it's the flu, if you know that there's okay, you should not have them come in. You should have them stay home and just give them the guidelines for caring for themselves there. And certainly, if their condition worsens, that they should call back and get directions from their doctor at that point in time. One of the other guidelines that we're working with now that is a little different and everybody is adjusting to it is who should be tested for influenza. People are used to coming in, I have the flu, let's test you for it. What they're looking at is a finite supply of rapid flu tests and a finite supply of antivirals. So they've published guidelines for who should be tested. So if it's a healthy person who doesn't have a risk for complications if they do get the flu, the recommendation is they should stay home and only get back in contact, well not only, but definitely get back in contact with their physician if their symptoms worsen. They should not be tested. The people they're recommending testing for are people that are at risk for complications, and that would be children under the age of 5, people over the age of 65, those that are pregnant, people with chronic pulmonary, cardiovascular, hepatic, hematologic, which are blood, neurological or neuromuscular or metabolism disorders, people that are immune suppressed, children or adolescents on long-term aspirin therapy, or residents of nursing homes. Those on an outpatient basis that are at risk for those should be tested, or well, they could be tested and then they can be treated with antivirals based on the doctor's judgment. But aside from that, the only other people that should be tested are the people that are so ill that they should come to the emergency room and they're going to be admitted to the hospital. They should be tested and they should be started on antivirals. Basically what we do know is the flu shot you got last fall did not have any protection against this particular strain of influenza. Okay, but there is a lot in the literature about how important it is to get the flu shot, that potentially there could be some residual there from a flu shot you got several years ago, that your immune system could respond to it. So one of the best things you can do is get the flu shot. Okay, this reinforces it even more.